Hello everyone, and welcome to another Arthritis Help session where you learn to move differently so you can feel better. I'm Dr. David Sofer, and today we're going to work on a session that's going to help us to expand the ribs and improve this lateral flexion, this side bending movement through the torso. Something that we don't really get into very much all the time, but a hugely important movement for standing balance, believe it or not, and actually walking comfort. Every time we stand on one leg, we're required to find this balance through the torso, and this is going to help us to do that much more easily. So for this session, you're going to be lying down, but you're going to want a pretty smooth surface where it's easy for you to kind of slide around on. So if you're on a yoga mat, you might want to put just a comforter on the floor instead, so that way you can kind of slide on the comforter. I'm using the sheet on my bed. So we're just going to get started laying on your back. Let's get to it. Okay, we're just going to start laying down on your back with a nice little check-in. And we'll just take 30 seconds for yourself. 30 seconds to just relax your breath. Tune out all the noise of life. Allow your body to sink to the surface. Allow your body to be easily supported by the ground. Release any tension that's holding you up, that's putting you on little points or stilts, and just letting it go. Feeling how you can conform like water to the floor. Feel that your legs can fall out apart, that your low back can release, that your ribs can depress, that your head can be heavy into the pillows. Okay, so for this exercise, we're going to start with one hand behind the head so that the back of your head is just resting on an open palm. Your right elbow is going to be down towards the floor. If your elbow can't touch the floor, that's okay. If it can, just let it rest out on the floor. And throughout this exercise, we're going to try to keep that arm open as best we can. It will pop up over time. I promise you, mine will too. We just have to keep reminding ourselves to keep it down. The right arm is out, the left knee is going to be bent, and the left arm is going to be along your side. And for this exercise, we're going to think of our bodies in three segments predominantly. We're going to think about the fleshy kind of waist part, the part between the pelvis and the lowest rib, right? And then we're going to think about those middle chunk of ribs right in here. And then we're going to think about the ribs in the underarm, which are kind of high up almost into the armpit. So we're just going to almost think about the body in those three segments. It'll be helpful. And so we're going to start with the hand resting on the head, the left knee bent, the right arm open, the left arm along your side, and you're just going to bend to your left, allowing your left hand to move down towards your foot a little bit and then come back. And so you're going from straight into a crescent or C shape. And this is where it's nice to be able to slide easily on the surface that you're laying so that you're not sticking, okay? And so just see where do you move from. And as you bend into that crescent shape, just feel, do you feel a stretch anywhere, a tension anywhere? And if you do you feel it on the right waist area, the right middle ribs, or the right underarm? Or do you feel a compression anywhere? Do you feel limited by compression in the left waist, the left middle ribs, or the left underarm? And then return and just notice where you feel you're tight, where you feel that tension doesn't necessarily mean that that area needs to be stretched. It may mean that other areas need to move more, that that area is moving a lot and other areas aren't moving enough. So as we go, we're going to start with this low waist area, this kind of fleshy area, and we're going to think about opening up the ribs to the pelvis on the right, and think, can you drive that movement through your right waist? Can you open up the right waist to help drive that movement to the side. How easily and how smoothly, and it doesn't even really matter how much you do, it just matters how easily you can move. And as you're thinking about opening up that right waist, you may also want to think about closing down the left waist, so bringing the left ribs into the left pelvis as you move that. And see how easily you can move from that lowest part of the spine, slow and smooth, as you go, allowing the elbow to stay open and not kind of pointing up towards the ceiling. That can be tricky sometimes. And feeling how able are you to just open the right waist and close the left. Slow and smooth. Good, don't work too hard. At any time, if you feel like you need to stop and rest, if anything gets uncomfortable, you need to shake it out, do that. Remember, rule number one, always be kind to yourself, always, always. In these exercises and throughout the rest of your life, okay? And we're gonna come now, we're gonna focus on the middle rib area right here. We're gonna see what we can do from the middle ribs. Now, we're gonna do the same exact motion, but we're gonna conceive of it in a different way. We're gonna think, how does it move if I open from those middle ribs and then come down? What if I made those middle ribs kind of the pocus? What if that was the fulcrum, or the most bowed out part of the torso as we go? What if I open from those middle ribs? And you can feel how hard I'm working because I can't talk so easily. I need to settle down a little bit. So let me see if I can move from those middle ribs a little bit easier with a little less ambition, a little less wanting to be the perfect model here, which I certainly am not, especially in this activity, this movement improvement session. This is something that's challenging for me. And feel that you can kind of clamp down on those middle ribs on the left side. That we can think about driving the movement either by opening the middle ribs on the right or by kind of compressing the middle ribs on the left. And how slow and how smooth and how easily can we make this movement happen without adding too much ambition, without trying too hard. Good, and then just lay and relax. All right, the next area we're going to think about are the upper ribs, or armpit area. And what you're going to think about is opening from the armpit, or you might even think about taking the tip of the elbow and driving it up. Those will both kind of give you the same idea. And you're just going to feel that from here we're moving the upper part of the torso up into those upper ribs and down as best and as easily as we can without strain. Without thinking, oh, I need to grab my foot. Just seeing how easily and how smoothly you can move and slide on the surface. And you could think about compressing through the upper ribs on the left, or opening through the upper ribs on the right, or even striving or elongating with the right elbow. Nice and slow, nice and easy. Feeling that that movement comes just in that area, not trying to tax the whole torso. Just that area, making sure your head is loose and relaxed. Don't let your head roll. And just seeing if it's a small movement, that's great. Make it a new movement. And relax. Beautiful. Okay, if that arm's uncomfortable there, just let it rest, let it shake out, and bring it in. In fact, let's do a whole new check-in. Lay down flat. Let your body release, relax. This one is a lot of effort for me, so I like to take some breaks in between and calm my mind and get out of ambition mindset, which I can flip into very easily, especially when I'm recording videos. All right, we're going to bend that left knee again. We're going to put the right hand palm open flat behind your head, elbow resting on the floor. hand next to you towards your, pointing at your foot. And now we're going to see if we can move all three at the same time, starting from the waist, feeling that we can move from waist to middle ribs, to upper ribs and elbow, all at once. Good, slow and smooth. Wherever you move to, that's fine. And feeling that we're putting it all together. And at the same time, you can even put a little push with your left heel in a way that helps to kind of curl the body into that crescent shape. Make sure that you don't let that elbow creep up towards the ceiling, and make sure that you come back and rest in between each repetition, that we're not doing continuous movement. We're taking a breath and then push through the heel, open the waist, open the ribs, open the armpit. Feel that ability to not only open on the right, but we're also going to think about compressing on the left. What if we compressed from the top ribs to the middle ribs to the bottom, and then back? And again, and then back. Good. Now let's do a few more of those, pushing through the heel, compressing on the left, opening on the right, and let's stay in that bent position. And let's think about how we return. Think about the opening and then feel all the open ribs on that left side compressing down to bring you back to center. So we got to remember this is a two-way movement. And so we want to think about how we open and push with that left foot to help us to open. And then find the return. Think about how you bring those ribs back towards each other in order to find center. Let's do that one more time. Push through and open. Good. Smooth and easily. And then compress down to return to center. Beautifully done. And relax. Straighten out the legs. Lay flat. And feel that nice opening through the left side of your ribs. And feel that when you breathe in, take notice that there's resistance from the ribs, preventing breath in. And feel if maybe the right side feels like it flows open a little bit easier. That we've been practicing inflation or expansion on that right side, that on your breath in, that left side is happy to expand, and on the breath out, it returns. And take a few moments to appreciate that newfound ease. Less tension with every breath is less accumulated tension throughout the day. All right, now we're going to begin with the left side, left palm open, resting underneath your head. Let that left elbow find its way down to the floor. The right knee bent, right foot on the floor. Right arm relaxed at the side of your body, pointing towards your right foot. And we're just going to start and thinking about the waist. And what if we open from the left waist and then come back? And feel ourselves open from the waist and then return down. How easily can we find that opening from the left lower torso? And then feel to return, we need to take those low ribs and pull them down towards the pelvis. And feel as you open the left waist, you're actually also compressing the right waist. So you're feeling the right ribs come towards the right pelvis and then return. Good, and this side, is a lot easier for me than the other side. So notice how I might be a little bit smoother and a little bit less effortful with my voice and my breath, something that my right side can aspire to. And then return. Okay, good. Let's take a look at the middle section of ribs now, kind of that big chunk of ribs in the middle, and see, can we expand through those left ribs and then compress them back down to return. Again, making sure the left elbow doesn't creep up towards the ceiling. Expand through those left ribs as we reach the right arm down. And then bring them back down to return. And open. And feel that the right ribs have to be able to compress, to be able to kind of clamp down into one another in order to allow that to happen. And then return. Making sure you're taking a minute, a second between each repetition, that you're not holding tension and that you're really focusing on driving the movement from that specific area of the body. You can even pick one rib and see if that can be your driver. Drive that rib out to the side to allow you to open up. Relax the breath and then pull the rib back down. Good. And now we're gonna think about the left upper ribs, so kind of like the armpit area and the elbow. And what if we tried to lift the elbow and open up the armpit in order to tilt down? And that's gonna be a very upper spine movement and not as big as some of the lower spine movements. We have less mobility through those vertebrae. And open. And come down. This one's a little tricky for me. Feel opening the armpit, opening the elbow, opening the ribs on the left, and also feel compression through the right upper ribs, and you might even feel depression of the right shoulder down as you come back. And open the left and depress the right. Good, easy. Letting the tension go. Making sure that elbow is not creeping up towards the ceiling. And feeling that you're allowed to move smoothly and slowly, and that you're taking down this desire to be big and to stretch, just how easily the clear path to movement and return. Good, let's take a rest. I like a rest. Oh, okay. And just lay flat and just take a moment to let the tension go. Breathe easily. And relax the ribs. Good, we're going to return to that same position, bending the right knee, left palm open, resting in the back of your head. And now we're going to try to move everything all together, so opening the left waist, the left mid ribs, the left upper ribs, left elbow, and then depressing everything on the right and seeing how easily we can find movement, and then return. And you can push with your right foot into the floor and feel how that helps you to open from the left and find compression through the right. And then when we return, you're pulling those ribs down to bring yourself back to center. And you're opening the left elbow and ribs, pushing through the right foot to find your way down. And returning by pulling back, feeling how your body rights itself, taking a moment. And feeling that easy push through the right foot to open everything on the left and compress everything on the right. And then returning all those ribs, compressing them together to bring yourself back to center. And again, press to slide and open. Very good. And then return. One more time. Sliding the hand toward the foot, opening the elbow. Good, holding and breathing. Once you're at your point, your open point, release the breath, release the tension. See if instead of getting bigger, see if you can be in the same place easier. And return. And lay flat. And relax. And get a sense of your breath. Feel the ribs expand. And feel the ribs compress. And feel the ease with which your ribs can float out to the side when you breathe in, and how nicely they can fall down when you breathe out. And just take a few moments to appreciate the ease with which your ribs can expand and compress, allowing the lungs to open and close and fill easily with air and expel the air. Very good. Okay, we're going to roll to your side and sit up nice and easy. Very good. Okay, take a moment, feel yourself in sitting, and then we're going to take this to standing and feel how this corresponds to standing, balance, and walking. So I mentioned before that this is an important movement for standing, balance, and for walking, and I'm going to show you how right now. Every time we stand on one foot, we're forced to move our center of gravity, adjust our center of gravity to line up over our base. We have a number of ways that we can do that to maintain balance. We can either do it in a compressive style where I'm still balanced, I can stand on one leg, but you've got my body going, my head this way, my shoulders this way, my hips this way, my foot this way. It winds up with a zero sum of balance over my foot, but it's not a particularly strong or functional or useful way to maintain balance. A better way to maintain that balance is to push up and move my center body over my base of support, which you can see is very similar to the movement that we were just working on. So if I push my right foot down into the floor, I open up my torso, you can see that my belt buckle and the buttons of my shirt move sideways over my base, creating height from the crown and this nice linear balance position as opposed to this compressed position. If I'm not good at opening up my side body or getting into that openness of that side torso, then I'm going to be much more inclined to compress, which is going to give me a lot of shearing forces at the hip, the low back, or into the knee. So we want to find that ability to be tall and upright through the ribs, and that's where that exercise that we did really comes into play. If you think about with walking, when you take a step, 80% of walking is on one foot or the other. So when I transition from back foot to front foot, am I compressing or am I able to stay tall and strong over the foot? And so there is, believe it or not, when people are walking, this little bit of opening through the side of the body to move the center of gravity over instead of compressing into the floor. So being able to do this exercise that we just worked on is going to help you with that standing balance and then with that walking fluidity. So if you want to practice that just on your own, you can stand against the wall or holding on to a cane or a chair or nothing at all. One toe just gently on the floor. You can hold on to the table if you need to and feel that you can compress, or you can open up. You can even put your hand behind your head just like we practiced and feel that you're going to compress the left side and open the right side to help you get this nice upright standing. And then come down and then up, and feeling that you're going to get a good workout from the legs, but also this ability to move through the torso makes it easier to find that upright stand. We can try the same thing on the other side. So you're just standing mostly on your left foot. You can tap your toes to the ground. You can put a hand on a table or back of a chair for balance if you need to. Put that hand behind your head just like we practiced and elongate up and out to the side and back, and up and out to the side and back, and feel how that's very similar to the movement that we've been practicing on the table. And here we're taking it into real life, into function, and as we walk we're going to find that same ability as we go from back foot to front foot and back foot to front foot. Good, opening through those ribs. Okay, I hope you found that helpful, and thank you very much for joining me this week, and thank yourselves for doing something good for yourself. I'll be back with you next week with a whole new video teaching you how to move differently so you can feel better. Take care, everyone.